Hello, this is Shae Spitz with Business Unscripted. I am here with Jessica with EastCentral District Health Department. Hello, Jessica. How are you?
Good. How are you?
I am doing good. I'm doing good. All right. How long have you been with EastCentral?
Well, I started as the WIC director back in May.
Of 2021?
Yes. Yes.
Okay. Okay. So you were kind of faced with a bunch of challenges coming in, with COVID, I'm sure.
Hmm.
What exactly is WIC?
So WIC stands for Women, Infants, and Children. And it's a nutrition and education program for pregnant women and kids up to age 5.
Okay.
So
Okay.
we do a lot of nutrition education, breastfeeding education, and then of course there's the food part as well. So they get free nutritious food to use at the grocery store. But
Okay.
we try to have contact with them 4 or 5 times a year just to go over different
Mm-hmm.
nutrition education aspects.
Mm-hmm. So a mother, and what does it take to qualify for WIC?
Well, there's a certain income guideline you have to meet, but having SNAP or Medicaid makes you automatically eligible for WIC.
Oh, okay. Okay. And then do they have to be single with kids? Can they be married?
Yeah,
Or
yeah, it can be any kind of status that they want. They just have to meet the income guidelines.
okay.
And they can have as many kids on the program as long as
Hmm.
they're under the age of 5.
Okay, so once they hit 5, they no longer get the WIC for that particular child. So
Correct.
if they have 4 kids and their ages 8, 6, 3, and 2, they would get WIC for the younger 2.
Right,
Okay,
right.
so then do they get any food like for the mom to help like her at all?
So when moms are pregnant, they're eligible to have their own food benefit package. And
Okay.
then after they have baby, they'll receive another food package. And she'll get that for 6 months no matter what. But
Okay.
if she's fully breastfeeding and
Mhm.
exclusively breastfeeding, she'll have food benefits for a year after
Oh.
her baby's born.
Oh, wow. Okay.
Yeah.
Okay. And then so that's what you were hired to do back in May, or that
Mhm.
portion at East Central. So what else? And you were just newly appointed to what over there?
So just a couple weeks ago, I was named the chief public health officer at an interim level. So,
Okay. And what
yes.
does that all include?
So that is kind of overseeing all the different services at East Central Health Department. We do a lot of different things like disease surveillance, COVID response, emergency
Hmm.
preparedness, tobacco, opioid, alcohol, kind of abuse and education on that. And then we also house the WIC department and the Early Development Network.
Okay. What is early development network?
That's for kids who may be developmentally delayed in some aspect,
Okay.
and they just help them connect to different services.
Hmm.
I can't remember the age guideline off the top of my head, but it's a lot like WIC where it's early intervention.
Okay. And then you connect them with somebody who can help them with the developmental disabilities like ESU. I know that ESU does something like that, right?
Yeah, yeah. So EDN, they work closely with all different organizations in the
Okay.
community. So they're able to connect the families to
Mhm.
anything they may be needing.
Mhm. Mhm. So, East Central Health District, where do you guys get your information? Because I know obviously with the COVID situation, that's fairly new. I mean, overall, 2 years now. But where do you get your information to relay to the community or to the public?
Well, specifically for COVID, we're always following the CDC guidelines, so we're always keeping on top of that.
Mhm.
Um, and then personally, we have the health directors, which is what I'm interim for. We meet a few times a week and we discuss the different measures as well as things that are going on with the COVID aspect, and kind of how we're going to respond to that because
Mhm.
COVID is always changing. So,
Yes.
yeah.
Yeah. Yep. Absolutely. So is that like a whole new department? Did you have to hire more people for the COVID response?
Well, at the beginning, I wasn't here when
Yeah.
COVID first started, but it was all hands on deck. So everyone was helping out with COVID.
Mhm.
Um, right now, we've kind of gotten away from that. We do have someone who's like a contact tracer.
Okay.
Um, and then also our epidemiologist, she does a lot of that too. So on top of the disease surveillance like influenza, rabies, things like that, she's
Mhm.
also really focusing on COVID.
Epidemiologist. What
Yeah,
is that for
yeah.
anybody who doesn't know?
They they study diseases.
Okay. Okay.
Study and track diseases.
Really?
hmm
Really? And what sort of diseases does she specialize in? And what do you mean track them?
So anytime there's an outbreak, well, especially right now, there's a lot of like influenza. So she's
Mm,
looking at a lot of the influenza rates through schools. Also things like norovirus, or anytime there's another kind of outbreak like foodborne illness,
mhm.
um, cases of rabies every once in a while,
Mhm.
anything that's kind of infectious.
Okay. Okay. All right. So then what else does East Central offer to maybe the general public?
I guess if we're looking at like direct services, we do have like radon kits. We have a
Oh yeah.
radon grant because there's really high radon levels actually here in Nebraska. So we have
Mhm.
radon kits. We also have water sampling kits because we have some grants that look at the lead levels in water.
Mhm.
Um, and then also, we're just a resource for anyone who has questions or want to get connected to someone else in the community. We're a part of a lot of different coalitions. We have a minority health program, health equity,
Mhm.
just trying to cover every base of health.
Yeah. So I know I've used your water sample. I've stopped over there and I picked up water samples before for real estate and testing the water. Now you guys provide those for free, and then we would then send them in and pay for the actual testing, though, right? But you guys provide the kits. Is that
Yes,
correct?
yes, we
Okay.
provide the
And you don't
kits.
do the testing there at your office. You still
No,
send them on to Lincoln or wherever it's at.
yep, yep.
Okay. And then now radon. You said radon grants. What do you mean by that?
So we have a grant where we get radon kits that we can
Okay.
give out to the public.
Okay, so not a grant that if somebody has high radon levels that they could get funding to get a radon mitigation system installed.
No.
No, just for the kids,
hmm
basically. Okay,
hmm
so and that's free to anybody?
Yes.
Okay. And are they like disposables? Because anytime I've had somebody do like a radon inspection, it's more so like this huge technology that they set in the house for 3 days. I guess how does your kits work?
This is just a little packet that you go and place in your basement for a specific amount of time. I can't remember off the top of
Mm-hmm.
my head. And then I believe it tells you if your levels are high or not.
Are they pretty accurate?
Yes. Yeah.
Really?
Yeah.
Oh, that's interesting. I'm guessing that you probably have to leave those in a little bit longer than maybe the paid for equipment, but that's interesting. I should try that sometime. You
Yeah.
know, if somebody
Yeah.
wants to get that inspected for whatever reason. I know because we've had it doesn't matter. It could be like this house will have high radon and then the next house may not. I mean,
hmm
even new construction can have it. So it's definitely what is radon to somebody who doesn't know what that is exactly?
It's kind of a hard thing to
It is.
explain.
It really is because
Yeah.
I've even had like training on it, and really it's something in the ground
Yeah.
that goes through the walls, which is why it's kind of irrelevant whether it's an old house or a new house. I mean, the newer homes will obviously have better protection
hmm
typically, but I've also seen where new construction has higher levels of radon, but
Yeah.
it's just crazy how it can get through the walls that are concrete, solid
Yeah.
concrete. I mean, I know concrete's porous, but just to
Yeah.
be able to get through there. And then what can radon cause, or why is it such a big issue?
It can cause different health issues, and it's especially prevalent like in northeast Nebraska, which is why we have these radon kits. Um, I think I don't want to get it wrong, but I believe it does affect kids more than adults.
Oh, okay. Okay. That's good to know. And it's probably more so like long exposure
Yeah,
versus
yeah.
just like
No,
immediate. Yeah.
you're not
Okay.
going to walk in and get sick right
Yeah.
away. So
Yeah. It's
that's why
just
a lot of people aren't aware of what their radon levels are.
Mhm, mhm. Yeah, from what I've been told, it's more so like if you're living in your basement and
hmm
you hardly ever come out, that's when you really need to be concerned about the radon levels. Like if you're just going up and down, but you don't actually like stay down there or sleep down there or anything, then it's not a huge concern, but something to kind of be cognizant of. So, now with your new role, obviously, I'm assuming that you're taking on a lot more responsibility.
Yes,
What's some more? Are you still doing the WIC program and everything then too?
I
You
am.
yourself?
I am. Yep. So I'm still doing the director part of the WIC program, but then on top of that, it's a lot of just additional meetings as well as the COVID response.
Mm-hmm.
Since we've kind of gotten away, everyone has to go and do their own programs. So I'm definitely
Meaning
like At the beginning of the pandemic, everybody was helping out with COVID, even people
Oh.
from EDN and WIC
Mhm.
and all those
Mhm.
other different programs. So it's really being the first to know about what we're doing with COVID-19 at the moment,
Mhm.
and knowing all the different programs or different services that become available from DHHS, and being able to disseminate that to the rest of the health department and then to the community.
Okay. Okay. And do you guys do any fundraisers or grants for the public for, housing or anything like that? Is there any benefits in that case?
Mostly it's just through our programs. Like right now, we have a Building Healthy Families program that's completely free to families. It's kind of a weight management for children who have a BMI of 95% or higher. And it's just a super fun program that people can come. They learn nutrition education. We do really fun games. They're not, you don't
Mhm.
have to be sporty to do it,
Mhm.
but how can
Mhm.
you modify your lifestyle and do this stuff at home?
Mhm.
And then we also have like a lifestyle coach almost who can help them get through those barriers, kind of counsel them. Um, and we partner with the YMCA. And that's what a lot of public health is. It's partnering with all of the
Mhm.
organizations in the community,
Yeah.
and figuring out how we can get services to people, and just, being a voice at the table.
Yeah. Yeah, absolutely. Just I think that a lot of people in the community don't know of what resources a community has or what they have to offer. And even if
Hmm.
they've heard of them, they don't know the extent of it. I mean, so like most people have heard of where you work, but they may not know the full extent of everything that you cover. So obviously, we talked about COVID, we talked about radon and wick. You said something about lead-based paint and water samples. I mean, what? And then this family program. Is there other things that you guys then offer then too?
I think besides those programs, it's a lot of just working in the community, like I talked about. So we have a community health needs assessment every few years.
Oh,
So right now, we just got that data back in the fall, and
okay.
now we're doing like a community health like implementation where we meet with all the different counties and we look at the data to see what the biggest health issues were. And then we kind of create an action plan for the next few years and how we want to improve the biggest areas we identify that we want to
Mhm.
focus on.
Mhm.
And that could be something like housing. So we
Mhm.
may not be able to, oh, here's some money for housing, but we can bring other organizations to the table and figure out how, as a group, as a community, can we address the housing issue.
Mhm. Mhm. What did you guys find out was some of the bigger needs that Columbus, needs from back in February, or I'm sorry, fall?
Well, we focus on districts, so there's Colfax,
Oh,
Platte,
okay.
Boone,
Okay.
and Nance. And I can't remember the specific ones for Platte, but I do
Mhm.
know like housing is an issue,
Right.
really big issue.
Yeah. Yeah.
And then also there's things like the non-communicable diseases like heart disease, diabetes, cancer, things that have always been an issue.
Mhm.
But
Mhm.
how can we address it now?
Yeah, so how do you address I mean, do you try to figure out what the why is? Because I think in order to be able to help resolve an issue, or you have to know what the reasoning is for it. I mean, is that something that has been studied, which I'm sure it has, but do you guys have a role in figuring out why heart disease is so much higher maybe in this district, or, childhood cancer? I mean, there's certain areas in certain states have high I think Nebraska has one of the higher diagnosis of childhood cancer. I mean, so do you guys help dig into the reasoning behind all of that?
Yeah, of course. That's what a lot of public health is.
Mhm.
Um, and those diseases, it's based a lot on social determinants of health. So that's where you're looking at income, race, ethnicity, all of those that are behind the why to the health issue.
Mhm.
And every community is different. So
Mhm.
that's when we also are looking at the different data we collect of income, um, the state of housing. Are houses dilapidated? We're looking at race, ethnicity, as well as age. If it's an
Mhm.
older community, the houses might be more run down as well. And how do we make it attractive for younger people to come in, young professionals, which could also help with. Um, I know all over Columbus, people are hiring, and how do we get that workforce here?
Mm-hmm.
Um,
Mm-hmm.
yeah, but things like childhood cancer, we're looking at the why, and then we come together, and if we're working with the hospital, like how can we all team up to do maybe promotion of health or promoting people to get screened early,
Mm-hmm.
so then we can reduce like deaths from cancer if we're
Mm-hmm.
getting screened sooner.
Mm-hmm. Mm-hmm. Do you notice certain demographics, or probably more so smaller communities, do they struggle more with health and fitness just because they have less resources? Is that, I mean, do you see that, or is that really not an issue?
Yeah, I think in smaller communities, when there's less opportunities to be active, if there's not as many, you know, running trails or walking trails, and that might be something we have as a goal in these
Mhm,
meetings is, oh, how do we create a walking trail?
mhm,
Um, but yeah, you'll see that with smaller communities. There's not as many resources, not as many opportunities to be active. So then you
mhm,
get higher rates of diabetes and heart disease and yeah,
mhm.
yeah.
Yeah, yeah, diabetes is a big thing because it can affect so much of your health. It's just like a domino effect. I used to work with, um, I was human service counseling years and years ago, and I know diabetes had a huge impact on not only their physical health but their mental health too. I mean,
Hmm.
if their blood sugar skyrockets, then it just affects everything neurologically and physically, and
Yeah,
it's hard to control. I mean, if you don't have control over it, it can be a huge. I mean, it can shut down your organs. I mean, all sorts of things. It's crazy. It's
yeah,
crazy.
yeah.
So, do you see a lot of diabetes then? I mean, and do you work with people who have diabetes and anything like that, or do research on it?
Research, I mean, not necessarily directly. Public health
Mhm.
is so many different
Yeah.
things. We're not focusing on just one.
Mhm.
So that's more where we come together as a community because, it can't just be the health department. It can't just be the hospital coming
Mhm.
together
Mhm.
to help fight some of those diseases.
Yeah. And kind of going back to nutrition, I think it is. I know, obviously funds is, or, income plays a huge role in people's nutrition
Hmm.
because obviously healthy food is expensive, which is unfortunate. I wish it was the other way around. I wish healthy food was the cheaper stuff and the more fattening food was expensive, because then I think our world would be completely flip flopped and people would be eating healthier, and like the what you take in has a huge impact on, I mean, your overall health. And I don't think people realize how much that affects their ultimate health on what they eat and just staying physically active. I know a psychologist that I would take my clients to way back in the day. He said that if every one of his clients would eat healthy and exercise daily, 50% of his clientele would not have to see him. And I think that's just a huge thing that we need to stress. And I think people don't really know what true healthy nutrition is, especially when
Hmm.
you do grow up in poverty. You grow up on canned food, frozen food that are high in sodium, calcium, colostrum, or colostrum, going back to animals. But I mean, so it's high in all those things. So you don't realize how unhealthy they are even when you get older, because that's what you grew up on. You thought that was the norm. You're kind of
Hmm.
eating healthy. And so educating people on health and nutrition is extremely important.
Yeah, yeah, definitely. And that's where I love the WIC program because I do have a nutrition background. It's we're able to offer those healthy foods and then also explain why they're healthy,
Hmm.
how to use them, different recipes that don't cost a lot of money but aren't packed with, you know, cream of mushroom or
Yeah.
the really high sodium, really high fat things that we really love here in the Midwest or that are cheap and available to us.
Well, and I think the other thing is people don't know what high sodium is, so they might
Yeah.
read a label and it says 250 milligrams per serving. Well, a lot of times people will think, okay, well, that's the whole can, the serving. No,
Hmm.
you also have to look at the serving size because it's definitely, it can be tricky
Yeah.
because the serving
Yeah.
size might be 30. Well, no, it's 250 milligrams of sodium salt per serving, and there's 30 servings in there. So if you eat the whole can, times 250 by, I mean, that's a little bit of an exaggeration, but I mean, I think it's misconstrued to the general public on the serving size if they're not looking at the actual serving sizes when they're reading the labels.
Yeah, yeah, it can be confusing. Anything can help in health is
Yeah.
it's difficult to kind of navigate.
Yeah, and then you have to do the math in your head, and you're like, "This and this." I know one serving size was like 1 and 3/4. I'm like, "I had to 1 and 3/4? What?"
Yeah, yeah. No.
No, just make it even and then do all the calculations down
Yeah.
below. Just do one serving size and there's 5 of them or the whole thing, I don't care. But yeah, then they try to
Mhm.
make it confusing so then it looks more appealing to the public. So, I guess for anybody who's listening, if they have any questions on any of the topics that we talked about, how could they get a hold of you or anybody there?
Well, we have an East Central District Health Department website as well as social media that has a phone number. And when they call, they can just say whatever they're interested in, and they can get
Mhm.
forwarded to whoever is an expert or the
Yeah.
manager in that program. Otherwise, they're always free to email me at
Okay.
jhicks@ecdhd.ne.
All right. So Jessica, what is the best piece of advice that has helped you professionally?
Um, I would probably have to say just saying yes when opportunities come up, especially professionally. Just even if it's out of your comfort zone, just saying yes because you never know where it's
Mhm.
going to lead.
I like how you use the word comfort zone because I always say that growth starts outside your comfort zone,
Yeah. It's
you
a
know?
hard thing to do, but
Mhm.
you've got to make that leap.
Yeah. Where were you at before this?
I was at UNMC in
Oh,
Omaha getting
okay.
my master's.
Oh, okay. Okay. And then came to Columbus.
Hmm.
Okay,
Took a
awesome.
leap. Yeah.
Yeah, leap of faith, that's for
Yep.
sure.
Yeah.
So, well, thank you so much for stopping by and talking to me about what you guys all have to offer and all the great programs that you guys can provide, especially when they're for free
Hmm.
to moms and kids and parents. So, I
Yeah.
appreciate you stopping by.
Yeah. Thanks for having me.
Thanks.